Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to give a brief presentation about some patients that I've successfully treated with microfragmented adipose tissue therapy. We'll get into what all this means, but I think the big thing for me is to educate more people out there that we have other treatment options besides steroid injections and surgery. And for those out there that say this regenerative medicine, orthobiologics, they don't work, well, there's living proof, and the data continues to pile up on how we do have other options. Don't get me wrong, I'm not saying that steroid injections are the world's worst thing. There's definitely a time and a place, in my opinion, about those. Some of my colleagues in the regenerative medicine space would beg to differ that there's never a time and place for it. Um, there's also a time and place for surgery. Sometimes joints need replaced, and that is a realistic factor. But where is the gap from conservative care to surgery? This is a very broad gap that we need to start focusing on because this is going to decrease the burden of our healthcare system, facility fees, insurance premiums, and much more. And that's the main reason I want to give this presentation today. So, as this title page suggests, you're healing your joints with your own biology. And this is an introduction to mFAT therapy. So here is a 5-star review that was left based off of a patient that I treated, 72-year-old female. The grinding pain was 100% gone. The results were wildly successful. These are her own words. Before, she had severe pain in the hip, a torn labrum. A lot of people have labrum tears, and those don't necessarily cause too much dysfunction, but can cause pain. But sometimes it does cause pain and dysfunction. She relied on a cane to walk. I remember actually every time she came to my office, she was using a cane more for balance and stability, not necessarily because of anything else. I felt like she didn't have any confidence walking on that hip. The orthopedic surgeons really said, you need a hip replacement. We actually tried in steroid injection to see if that would turn off her pain even temporarily. It only worked for a few days, and after that, her pain came back. As we know now, even one steroid injection can cause an increased rate of that joint being replaced. So they took a subset of patients and they did injections of steroids in a joint, and they showed the patients that got the steroid injections actually went on to have a joint replacement faster than the side that didn't, or the patients that didn't have the steroid injections in that joint. Now, if you go back to some of my other talks, one of my theories is this lymphocyte to monocyte ratio and how steroids can cause that involution of the lymph glands that produce a lot of positive immune modulators for chronic disease. That's one of the multifactorial mechanisms that may be causing that increased risk of degeneration of the joint. Now, we do know steroids and especially the anesthetic agents that we add to the steroid injections both are toxic to the cells in the joint space, especially the joints that are the chondrocytes that the bone is made of. So these are at least 3 or 4 mechanisms that we just talked about, but there's a whole plethora of other ones that we're still scratching the surface on. So what is mFAT? That's a great question, right? So we're using this fancy term. So it's a regenerative therapy that uses your own body's processed fat to reduce inflammation and promote natural healing. As you can see, there are mesenchymal stem cells. These are the only stem cells that you might be able to find in our current treatment algorithms. I don't want to go too much into the Wharton's jellies or the placental tissue or umbilical cord tissue. Those actually, unless it's fresh, literally same day, they're once they flash dry them to ship them out, they lose all viable stem cells that might have been available in there. Don't let these marketing companies fool you otherwise. Um, I again don't want to get too much into it. I'll have more and more talks about this as I go forward. So these mesenchymal stem cells have healing agents, growth factors, peptides, bioactive peptides, we should say. They have molecule called IRAP, which is naturally pain relieving and anti-inflammatory. So there's a bunch of growth factors in these mesenchymal stem cells. The other thing that's interesting about fat and where we use this a little bit more heavily are these pericytes. These pericytes actually attach to the vessel walls that supply blood to fat, and they help support vascular healing. So they have other growth factors that help the blood supply um, to the areas that we're treating. It's very interesting because these originally thought as just support cells, but we're starting to see how they interact to activate these mesenchymal stem cells. And the other thing is structural healing. The fat is naturally thicker. So if you have like a torn rotator cuff tear, you can actually fill in that void with mFAT to help a scaffold. I don't want to sit here and say that it repairs it or regenerates it 100%. That's not for me to discuss. That's probably not the right way to think about it. But if you think about there's a gap or a tear and you put a scaffolding in, you allow your body to have a little bit more of a structurally sound tendon, ligament, etc. So that's just something to think about. I want everyone also to think about that fat in itself is hormonally active, meaning it responds to its environment. It responds to what you put into it. It also responds to what when you're going through starvation and stuff like that. There are lots of receptors on fat cells, and those fat molecules will either expand or um, contract based off of what its environment is giving it. And I think that's something that's very underrated when people talk about fat. And I think this is another reason why fat is such a successful treatment algorithm for arthritis, especially moderate to severe arthritis. And we'll talk a little bit more about other treatments for very severe arthritis down the road, not for today's talk. So, what's the procedure look like? It's an outpatient process. It takes about 60 to 90 minutes. I always tell my patients to book it for 3 hours just in case we need extra time to support the patient, et cetera, et cetera. So we harvest the cells. It is a mini liposuction procedure. Without a doubt, 100% of the time, patients are like, oh, can you take some extra fat off? Unfortunately, the amount of fat that we take off is non cosmetic. It would take a lot longer and probably not worth the time to do that for someone. Plus, I'm not a plastic surgeon. I don't want to make patients feel like, oh, one side looks worse than the other because we do harvest fat from both sides to make it somewhat symmetrical. My preference is from the flank. I have colleagues that take it from the abdomen or the thigh. I think it's just a personal preference. They're all just as successful as far as we've seen so far. You use FDA cleared systems, Lipogems or Mini TC. There are other systems out there that are FDA approved. There are also many companies trying to improve theirs and get the licensing from the FDA as well. So just something to keep in mind if you have a physician doing this, make sure they're using a FDA cleared device. For what it's worth, could if it wasn't FDA cleared, they might be cutting corners, can maybe yield a less than desired result, or can lead to more serious adverse outcomes. So then we wash away inflammatory oils and microscopic keeler fragments. So each system, we'll say lipogenesis TC, et cetera, et cetera, they have a different way of processing the cells. So in the United States, we can only do minimally invasive or mechanical, meaning centrifuge, ball bearings, maybe some filtration, but we can't use any enzymes. We can't grow these cultures. As far as we are in 2026, these are the rules. This might change in the next 10, 15 years. There are great companies and some of my colleagues doing culturally expanded cells outside of the United States for research purposes, but also treating these patients with those research purposes. And then the last thing is, we use a targeted image guidance to the proper tissues. So if you want to go back to the shoulder and we had a rotator cuff tear, sometimes we have arthritis or inflammation in that joint as well. So not only do we fill in the void of the tear, but then we also maybe do a glenohumeral joint injection with some of the mFAT. We might do it in the AC joint, or acromioclavicular joint. We might get some of the other supporting structures. So this is the difference between and we'll call it what it is, a chiropractor that allows a nurse practitioner to do injections that does not use ultrasound guided plus and or fluoroscopy x-ray guidance, and a practice of like my own where we are versed in both fluoroscopy and ultrasound, and we make sure we target all these things. If anyone wants to come out and say, oh, image guidance is not needed, we can do it blind. I've been doing this for many years. That is such an old way of thinking. And the studies have shown repeatedly that a targeted way of injecting yields better results. But the other difference is a lot of those old studies were based off of intra-articular injections. We have to treat the whole structural unit, meaning not only do we have to do in the joint intra-articular, but we also need to do the tendons and ligaments and maybe some muscles and maybe around some nerves. So there's a lot more that goes into it than just, oh, here's a joint injection, et cetera, and have fun, good luck. We actually want to make sure we're hitting all the important structures. So here's another testimonial from another 5-star review patient. As you can see, she was also facing a hip replacement. And when she came to talk to me, felt like she was given a real option instead of just being handed a surgical timeline. She was, again, severe pain. She definitely needed a cane or walker for longer distance. After we talked about this treatment option, and we went ahead with the treatment, she no longer needed her walker. And I still recommend her to keep her cane because she did lack some range of motion. But she said, I feel so much stronger. I can walk faster. And she's going through her physical therapy regimen now with much brighter outcomes of, hey, I can start moving again. I can start taking care of myself again. And mind you, she was on the schedule for a hip replacement, and we decided to do this, and she's very pleased with the results. So what conditions can we treat with mFAT? Osteoarthritis, knee, hip, shoulder, those are the most common areas we treat. Now you could do finger thumb joints, you could do ankle joints, etc. But these are obviously the ones we treat the most. It does relieve pain, chronic pain, and overall function. Um, again, the IRAP and other growth factors that are in there help. Tendons and ligaments. I talked about this in the rotator cuff. We can fill some of those voids, and it acts as a biological scaffold to help assist in repairing partial tears. Don't want to say it can help repair a full tear. That's a conversation for another day. Studies are out there. And something that people talk a lot about, like meniscus and labrums. Yes, we do inject these into the meniscus and labrums, and it helps support. It's not going to help regenerate. I don't want to say that, be very clear, but it's going to help support and give some extra scaffolding and cushioning in that area. So let's weigh our options. mFAT, minimally invasive, outpatient procedure, no downtime outside of the healing process. It's all your own biological tissue. Rejection rate is very low. It's natural compatibility. Um, as you can see, a general price is 6,000 to 8,000. Uh, some places charge higher, some places charge lower. That's just kind of a generality. Um, won't talk about my pricing here, uh, but that should be kind of what you're looking for, ballpark. And it also depends on what state you're in. If you're in somewhere like California or New York, where prices tend to be higher anyway, you might be looking at a little bit higher of an investment. In my practice, we don't just offer just here's your injection and we're done. It comes in a much more comprehensive package for your healing. Surgery, major surgical intervention. You have an artificial joint and hardware. There is rejection, hardware failure. The joint might need to be replaced again, 5 to 10 years, et cetera, et cetera. You are downtime. You are kind of sitting up in a bed for several weeks. As much as they encourage your physical therapy, and physical therapy is one of the most important portions of surgical treatment options, it's tough. But here's the other thing, the investment that insurance companies will pay for hip replacements and knee replacements. But what people don't think about is the high deductibles and copays. So if you want to run this back and you start talking about, well, what is my initial investment? You have investments of physical therapy, x-rays, MRIs, and then you have the facility fees. And facility fees are several thousands of dollars nowadays. It's no longer just a few $100s. So you're still paying relatively around the same price when it's all said and done for the same treatment. Well, sorry, for a different treatment that might not work and you're going under surgery. Anesthesia, as we're seeing, is not the best choice for you if you do have multiple surgeries. If you can avoid anesthesia, I would recommend doing it because we're seeing poor and poor outcomes with people that get increased anesthesia over their lifetime. So explore your options before committing to surgery. That's the biggest thing I want everyone to take away. Find out if mFAT therapy is right for you. It's a biological blueprint for your healing. Last 5-star review. Another patient I treated, and this patient was more praising me, and I really appreciate this patient giving me such great accolades. Is very understanding and listens to the questions, the concerns for the best outcomes, and that's what's most important to me. So, yep, if you want to book an appointment, it's essentialsportspine.com, request an appointment. Some of my social media handles where I talk a lot more about regenerative medicine, healthy living, just other options outside of what the current medical model is allowing us to talk about. And that is what my whole platform is about. So, yeah, please book an appointment. If you or someone you know have had mFAT treatment as a therapeutic treatment, please drop a comment below. If you have questions, comments, otherwise, please drop them below. And I'd love to talk more and help you out. Take care.